lifestyle that we want people to modify. If you are smoking, we will encourage you to start smoking. If you are a high alcohol intake, we need to reduce alcohol intake and eat healthy and exercise. Exercises.
Okay. Because the lack of active, um, I mean, physical activity, where you do your jogging or do other things, can also lead to somebody coming down with breast cancer. Because it will get so big, and at the end of the day, they get prone to it.
No, we are just saying these are lifestyle that should be modified.
Modified.
Yeah, promoting exercise, healthy eating, reduce your alcohol intake, and start smoking.
All right, let's
So,
yeah, Angel.
Dr. Smith, so Mrs. Smith, does breast cancer have types? What are the different types of the breast cancer? Because I've learned when I was reading that it has other types. Apart from does it have?
So breast cancer as a whole is breast cancer. Once that cancer said, I think I told you at a particular organ, it refer to that organ as the cancer of that organ. So if you identify that abnormal cell growth in the breast, it is referred to as breast cancer.
Okay. So do we talk about some interventions then carried out by the Ministry of Health to, address the issue of breast cancer in the country?
So some of the interventions carried out by the Ministry of Health to address breast cancer in the country, firstly at the national level, is to develop our policy document and strategy, where we outline programs and intervention to reduce the burden of breast cancer in the country. We also work through our county health team. So currently, we also work with our county health teams by sharing key messages and awareness. So for this month, we were able to send out key messages to all of the 15 county health teams, encouraging them to promote clinical breast examination. We also share talking points where they should be able to talk about breast cancer at all of the health facilities and in the nearby community as well. So there are some of the intervention for this month. So in generally, when it comes to care for cancer, I already mentioned, we have only 2 diagnostic facilities where you can do the test to confirm that you actually have cancer. So the major hospital that diagnose cancer in Nigeria is at GFP. So when you suspect in a county, you have to refer your patient to GFP where they will be able to do the test to confirm that that person has breast cancer. We also do testing for breast cancer in Jackson Edward Hospital, but they are now all of the tests that is being done there. So GFP do most of the tests. So when it comes to treatment, access to treatment, we also have an oncology unit at GFA, where Dr. Suku is the acting head for that unit. She's doing a great job there, managing all forms of cancer cases, including breast cancer. We also have treatment options available at Hope for Women International facility, the Wellness Clinic, and I mentioned in JJ Dawson Hospital in Meridian. There also some form of treatment being administered for breast cancer.
So what are those treatment options you are talking about? Apart from, because I'm more about the surgery aspect of it, do we have other treatment options, and what are they?
So for cancer management, patients have to go through chemotherapy. We also do surgery where necessary. And other management for cancer also is radiation. But for Liberia, we don't have access available where you have to bring the cell of that organ where you suspected or the breast to start the spread, bring that organ or the cell to start the spread of cancer. So we don't have the option of radiotherapy available, but we are making a lot of efforts. Under the leadership of Dr. Louise Nkoto, she recognized that care for cancer in Liberia is something of top priority. And in the last few months, there have been a lot of effort put in place for a groundbreaking ceremony at JFK to ensure that we have a radiotherapy center. And this effort that have been supported highly by the President of the Republic of Liberia, Ambassador Joseph Nnabuaka. So it tells you that as a country we prioritize the care for cancer in order to ensure that we have a holistic approach to managing cancer in Liberia.
Let me take you back. Something quite important, especially for the young ones, the young females like coming up and especially passing age 15 now. You talk about, I didn't hear you mention about the reproductive history or you talk about early menstruation. I'm very keen to know, to just explain, take your time to explain that particular cycle, why early menstruation is mentioned. We talk about the reproductive history, late menopause and all of that. So they are risks, they are factors that can easily contribute to breast cancer.
So like we mentioned, there are some factors or risk factors associated with breast cancer. So for reproductive history, so people who have had their menstruation or their period very early, we are not saying everyone, but if you know that you had your menstruation at a very early age, we are encouraging you to check. We are not saying that because you had your menstruation early, it means that you have breast cancer, no, but it is a risk factor. A woman who also had her menopause or start seeing her time very late, we are encouraging you to continuously check your breast.
Okay. So if a woman has breast cancer and maybe she has a baby, is it advisable to breastfeed when the cancer is on one breast and then one is not affected? Is it advisable for the person to breastfeed? What advice do you have in that direction?
So one of the things that we want to encourage, especially for women with babies, is to breastfeed your baby. It also helps to reduce the risk of breast cancer. We are not saying breastfeeding means you say babies, right? So we want to promote infant breastfeeding. And one of our key messages we want to emphasize here, breastfeeding helps to reduce or remove risk of breast cancer.
Okay. So it means that they can breastfeed even if they have a cancer on one side of the breast.
So with doctor advice, so that's why we say go to the hospital once you suspect that you are having any change in your breast or so in your breast. So with doctor advice, they will be able to tell you to breastfeed or not to breastfeed.
So I want to know, can someone get the breast cancer by getting in contact with someone, with a person that is affected, maybe through bodily fluid? What's the possibility of that?
So cancer cannot be spread from person to person. It's not contagious. If somebody has cancer, you say to them, you touch them, you cannot get cancer through that. I think we listed some of the factors responsible. We talked about the genetic factors. We listed being a woman, aging, all of those things. So you cannot get cancer by coming in contact with somebody who has cancer.
So we have some lifestyles that put a person at risk.
Yeah.
Lifestyles.
She already mentioned them.
Okay.
Yes.
All right. So let's move over to the World Breast Cancer Month. And the activities set aside to celebrate breast cancer in Liberia. Because I know we did a launch of the Breast Cancer Month on the 1st of October. Are there other activities that the public should look out for following that?
Yeah, so we had a national launch on October 1st at GFK, and series of events, including the radio talk show. That's why we are here today. So there will be another radio talk show at the end of October.
Okay.
We also have the cancer awareness walk
Okay.
that is happening on the 25th of October. And as I said, the county health teams, they are also being given talking points to have health talk at the facility in the community to promote clinical breast examination. So these are just some of events. And for GFK, they are offering the testing exam for breast cancer at a discounted price. So we want to encourage every woman listening to be able to do your breast clinical exam or checkup for cancer.
When it comes to the breast cancer work, it's something that a lot of women, come out for. What it takes for a person to be a part of the breast cancer work campaign, what do they need to do?
So the campaign is open to everyone. So we have a wide range of stakeholders that we're able to reach out to. We have our corporate community, the banks, we reach out to them. The business people, the market women, health workers, the lawmakers. We want everyone to be involved in this fight against breast cancer, because breast cancer, it affects individuals, it affects household, it affects community, it affects every race. So putting our effort together as a country, supporting awareness, supporting community engagement efforts, talking about breast cancer openly, promoting open discussion in a way that it helps to reduce the stigma associated with breast cancer, where people feel that it is a witchcraft situation. It will provide people with the right knowledge to make informed decisions. We say because of lack of knowledge, our people perish. So we want people to know that breast cancer, once detected early, it can be managed, it can be controlled. That is why we are promoting early detection, encouraging open discussion about breast cancer in and around our communities.
So for it can be managed, it can be controlled, can it be cured totally?
Yes, breast cancer can be cured. So we have a lot of survivors.
Okay.
People who have come out during the launch, we had 2 persons that were providing a story on how they went through the course of treatment at GFK, and they have been cured of breast cancer. So once detected early, it can be managed, it can be cured.
Okay. So we have Dr. Subud. She's just joined us, so she's gonna give her takes on this discussion as well shortly before we open the phone lines. So Dr. Subud, good morning. Welcome.
Good morning, thank you.
Yeah. Good morning. Welcome to the program, Both Ways to Health.
Thank you.
Thanks for showing up. Can you introduce yourself for the benefit of our listeners?
My name is Dr. Dede Sukumu, and I am a cancer doctor. I work at GFK. Hospital.
Okay, I saw the oncologist. Does it mean cancer doctor?
Yes.
Okay. All right, welcome. So, Murphy, can we open the phone lines before getting back to? Huh? Okay. So that at school we've been talking with Mrs. Smith. She has been telling us more about the breast cancer and other things associated with it. So just give us a general take on breast cancer.
Well, breast cancer is cancer that happens in the breast, and according to WHO's data in Liberia so far, it's the second most common cancer diagnosed amongst Liberian women. We know that we all talk about the breast a lot because the breast is part of the beauty of a woman. So, and it's part of the physical structure. It's what people see when they look at a woman for the first time. So that's why people talk about breast issues a lot and get a lot of sensation. Unfortunately, in Liberia, we have not done a lot of awareness around breast cancer, so we are still seeing a lot of our patients presenting at very late stage when not much can be done for them. So we still have a lot of work to do when it comes to the issue of awareness. So October is the month that I start for breast cancer awareness month. So I believe that this month we all will be talking about breast cancer and breast related issues a lot. But then the question is, after October, then what's next? The campaign needs to go beyond October, so it should not just be about breast cancer awareness month in the month of October, and then we all get on radio and talk about breast cancer, and then at the end of the month we wear our pink and white and look all beautiful, and then walk against breast cancer or walk towards awareness for breast cancer. We should go beyond the month of October. I believe that breast cancer awareness should be done every month of the year, not just in October. And that's the reason why I believe Mr. Smith is here today to tell us more about what the ministry's plans are in terms of public awareness for breast cancer outside of the month of October.
Let me ask you this question, Dr. Supu. You are responsible for this division. You are
No, I'm not responsible for the division.
When it comes to the treatment, we are talking about the treatment.
So I know I know Mr. Smith controls that, but what I'm saying, the
I'm
expert. Yes, you are the expert in that area.
Yes.
So are you well positioned? Do you have the equipment in terms of carrying on some of the major surgeries when it comes to breast cancer? Do you have the equipment? Do you have the manpower?
Manpower, I would say no. I don't have the manpower. One fact is that I'm the only medical oncologist in the country, so that alone states that we don't have manpower because it's just me. I'm the only medical oncologist, so manpower we don't have. When it comes to the issue of treating breast cancer, we offer some form of chemotherapy at John F. Kennedy Hospital, where I opened the oncology unit. It's been open for the past 1 year and some months. We opened it April last year, but we still have a lot of limitations. The space is small, so we have to work with what we have. We have 6 beds available for patients, so we can take 6 patients at a time. And imagine with the increasing number of patients that we are having, because we don't just treat breast cancer in the cancer unit at GFK. We treat all forms of cancer, so when they come for the chemotherapy, they come to the unit for treatment. So now at John F. Kennedy Hospital, where I am assigned, we do a lot of breast surgeries there because we have general surgeons who do the surgical aspect. I don't do surgery, so when it comes to the surgical aspect, I refer them to my colleagues. They handle the surgical aspect and then send them back to me, and vice versa. So we do offer surgeries in some form of chemo. I say some form because we don't have most of the chemotherapies that we need, and chemotherapy is relatively or literally referring to drugs that we use to treat cancer patients. So we have some form of chemo. We offer some form of chemo, let me put it that way, because the patients have to procure the medications themselves and then we administer it. So we still have a lot of work to do. When it comes to radiation, we don't have radiation in Liberia. We know that recently our President, His Excellency Honorable Joseph Numa Brightard did groundbreaking ceremony at JFK sometime this year for the radiotherapy center. Mrs. Smith can speak more to that because that is on the ministry level. Yes, so I believe the planning and what have you are in the works. So I am on the clinical side, so I will stick to the clinical aspect and tell you more about the treatment of breast cancer and other cancer patients that I deal with in the hospital because I'm at the hospital, I'm not at the ministry.
So after maybe perhaps when surgeries are done on people who have breast cancer or any form of cancer and they are being sent back to you, after they are discharged from the hospital, what kind of medical advice do you give them when they are going back home? What do you tell them?
Well, I'm not there when the surgeons are discharging them, so but I mean, I believe the surgeons gave them the same advice that every surgeon will give a patient who has undergone any form of operation. So like wound care is very important. That's for a fact. Wound care is very important because you have to keep the wound clean and dry so that it's not infected. And usually when they undergo surgeries, we give them about a month so that the wound can heal at least outside, because wound takes longer time, surgical wounds take longer time to heal completely. But outside, the part that we see from outside, at least about a month is enough time for the outer part of the wound to heal and close up so that the patients can come to start the treatment. So when they undergo surgeries, we usually give them about a month to recover from the surgery, and then they come to me to start the chemo.
Okay.
The reason we give them that 1 month is because the chemotherapy has some form of immunosuppression. Some of them, in some way, can inhibit or stop wound healing. So it's best that the wound heals to an extent before they come and start the chemotherapy. And then we also inform them that pain is another complication of the operation because of course you're cutting them. So we inform them that you will experience pain for quite a while before it goes away. So yes, those are some of the advices we give the patients.
Okay, so you are in the hospital setting. I know you've been dealing with a lot of cases of the cancer, especially breast cancer. Can you share with us some of the success stories? I mean, you don't have to call names, just some success stories that can motivate.
Well, I have a lot of success stories. Success is relative. Let me put it that way because we treat patients for different reasons. The intention of treating, it depends on the presentation of the patient. So if a patient comes to me with a very early form of the disease that has not spread yet, and she can undergo surgery and have the breast removed, and then undergo her post-operative chemotherapy, and afterwards we repeat all her imaging and we found out that there's nothing there, that's a success story, and I have a lot of patients there. On the other hand, if I have a patient who came to me from the beginning and the patient was already on stage 4 breast cancer, where the cancer has spread everywhere, at that point I am not treating him or her to cure her. I am treating him or her to palliate.
What does that mean?
Palliate means to make them as comfortable as I can, to buy them as much time as I can. So if a patient comes to me with a breast cancer that has already spread to the liver, the lungs, the bone, or even the brain from the very beginning, and I can treat her and she can live for another 1 year or 2 years, that's a success story for me because I was able to extend her life for another year or 2. So success is relative. And the success, like I said, we treat for different reasons, so success is relative. So if we're talking about success stories, I would say that I have a lot of success stories. It depends on the point from which you will define success. But for me, every patient that I get to treat, whether the patient was already on stage 4 and I can treat her and get her on, buy her another 6 months and give her another 6 months of her family, that's a success story for me. Yeah, so success stories are there.
So what is your lifespan? You got a question?
No, maybe
What is your
just answer,
lifespan?
then we'll take a few
Because I
questions.
hear you say the person lived for maybe 2 years and it's a success story. Does that mean that we have a year lifespan for people who are infected when it comes to managing the
No, no, no,
condition?
no, no. No, that's not what I meant. So, in cancer management, we do survival rates on 5 years, 3 years, 1 year, 3 years, 5 years, and more. And what I would say to you is that the earlier the presentation, the earlier the diagnosis, the better the survival outcome of the patient. So, if a patient presents to me with a stage 1 breast cancer or stage 2 breast cancer, the chances of that person being alive 5 years later is close to 80 to 90%, as compared to someone who comes to me for stage 4 breast cancer that already has the cancer spread everywhere. The chances of that person being alive at 5 years is actually more like 40%. Yeah, so going back to the success story, let me give comparison to make you understand what I mean. There was an elderly woman who I saw for the first time in the earlier part of 2023, and she was a stage 2 breast cancer, meaning that the cancer had not spread beyond the breast. It was in the breast and in the lymph nodes underneath the arm. She underwent surgery and she received her chemotherapy successfully, and she has been on a follow-up for close to 1.5 years now. Every 6 months we do her CT scan, and she has been fine. She has been going on. So from 2023, she was at the stage 2 at the time she was diagnosed, and she's still alive now, ongoing follow-up. That's a success story. On the other hand, I have a patient who, in 2023, when she presented, she was already a stage 4. She had a cancer spread already to her bones, and she's still alive. So that also is a success story, even though she's still undergoing treatment, but that is a success story. So it depends, yeah.
Okay, so we're about to open the phone lines to have our listeners participate. The earlier the presentation,
The better the outcome.
the diagnosis, the better the outcome. So if you just joined us, you're listening to Roadway to Health, an hour-long program brought to you by the Ministry of Health. We're in talks this morning with Dr. Deda Superwood, medical oncologist from JFK, and Mr. James Etta Smith, the Director of Non-Communicable Diseases and Injuries Unit at the Ministry of Health. To be a part of this discussion, you can call us on 0775 677 376, 0775 677 376, 0880 514 096, 0880 514 096. These are the numbers to call. Call us this morning. We are talking cancer, man. This is something that, I expect more women to call. Melvin, I think the women should call, right? So we have our first caller. Let's take this person. Melvin? Good morning. Good morning.
Good morning, Mama. Good morning.
Yeah, go ahead. Your name and where do you join us from?
I'm Elizabeth Doughton calling from FDA.
Go ahead.
Hello?
Go ahead. I'm getting you.
Oh, okay. What I want to ask on that cancer problem is, do you both believe that cancer can be killed by herbs?
Okay, the doctor will respond to that.
Because what got me to ask the question is, hello?
Go ahead.
We don't have time, please.
My late father, if I have heard for that, even that according to our health director to Phoebe, that according to already on the minute that had cancer that she could not do any other things. So people that didn't carry that woman to Phoebe,
Okay.
contacted my father. So when my father treated that lady, after a month or two, send her back to that according to at the time that begins.
All right. Okay, let's take this person. Good morning.
Good morning.
Can you walk away from your monitor?
Yes, I will, please.
Go ahead. What's your name and where you calling
Yes.
from?
Nancy Harris calling from Police Academy. I want to take this time to tell Dr. Subu thank you so much for us in Liberia. Because as I speak, my sister is one of her patients, and she's trying and she's doing well. Well, my appeal to the government, the chemo treatment is so much expensive for we the poor people. As I speak, my sister now the treatment that she's undergoing is about $540. It is after every 2 weeks that the woman needs to go under this treatment. So it's so streamy, it's so hurtful to me. that I appealing to the government of Liberia to please help this woman, this doctor. She has come to save us in Liberia. Let the
Okay.
government see it necessary to help us with this treatment.
Okay. All right. Good morning.
Good morning, how are you?
Your name and where do you join us from? Be fast.
I'm Augustine Kopo, I call you from Bonchama, Lofa County. Let me appreciate your guest. My concern is the issue you asked a question as regard to the child, if the child is breastfeeding when the mother, one of the breast is suffering from cancer, whether that child will be affected. I really want her to emphasize on that point because there is some perception that once the child suck that same breast, the child will definitely be affected.
Okay. All right.
Thank you.
Okay. So we don't have time. At the school.
Okay, yes,
Just
so,
quickly respond to the callers.
yeah, so the first question was the issue of the herbs. I'm a doctor, so I will not encourage patients taking herbs because you might think that you are treating that cancer with the herb, but you are exposing that patient to liver problems. And if you continue, the liver will kill the patient before the cancer does. So herbs are not advisable. There are medications to treat cancers. So as a doctor, I will not encourage people to give herbs. For the last question about the breastfeeding, cancer is not infectious. Let me make this clear. Cancer is not infectious. So even if your wife has breast cancer and you are laying next to her, she cannot give you cancer. If a mother has breast cancer, she cannot pass it on to the child through breastfeeding. In fact, breastfeeding is one of the things that is encouraged to prevent breast cancer because the more you breastfeed as a woman, the more you are protecting yourself against breast cancer. But cancer cannot be transferred from a mother to child through breastfeeding. So I hope I
What's about the lady who called for that her sister is one of the patients? She spoke about hike in
That
the
was
price
not a
of
question.
medication.
That was
She was
not a question.
recommending
That
to
was
the
an appeal
government.
to the
Yes,
ministry.
so she was
to the
appealing. So
government.
you care to speak to that?
So, put a government in, we take note of that. We know that the cost for cancer is very expensive. So some of the intervention beyond just the October month is to continue the awareness across all of our county. And currently we have some commitment from WHO to train more health workers to be able to diagnose and make the right referrals for cancer management. And we want to emphasize early detection is very important for treatment options and for high survival rate for cancer.
Okay.
So, Mrs. Smith can just give us her party comments because she was already in flight before we go to Dr. School for her party comments. Madam Smith, please go ahead.
So for call to action, we are asking all stakeholders, market women, the banks, business people to join the fight against breast cancer. I'm talking about breast cancer openly, so the more you discuss it, the more you break the myth. We want to encourage early detection where people should be able to self-examine their breast. I think I talked about that earlier. Come to the facility for clinical breast examination. That's our call to action.
Thank you.
Okay.
Mrs. Smith.
Dr.
Dr.
School.
School, quickly.
So early detection is very important for me because I rather my patients present early than to come late, and because it puts a burden or strain on all of us. So early detection, screening, awareness is very important. Let me use this time to say that at JFK right now for the month of October, we are doing free clinical breast examinations in the outpatient clinic. So Mondays, Tuesdays, and Thursdays, you can come and have your breast examined for free. Now, to add on to that, our dynamic CEO, Dr. Lena Birch, has given 50% discount on everything breast related. So from surgeries to outpatient consultation to CT scan to ultrasound, everything related to breast will be given at a 50% discount for the month of October. I'm using this time to encourage people to take make use of this opportunity so that we can see as many persons as we can.
All right.
Let us go out and encourage everyone to examine their breast and talk about breast cancer more.
Thank you so much. Dr.
Okay,
Supo.
thank you. The earlier the detection, the earlier you present, the earlier your diagnosis, the earlier your chances are. With that, this is how I would like to leave you on today's edition of Wood's Way to Health. Dr. Superwood and Mrs. Smith have been our guests here this morning. My name is Angela Noor, and we have
Melvin Stewart.
until next Tuesday. Have a good day.